areas. Emotions were running high for many of us before this storm because of the pandemic, and now it's life to no power and lots of cleanup, which can be overwhelming. Hartford Healthcare wanted to address our emotional needs today, so we have Patricia Rehmer joining us. She's president of Hartford Healthcare's Behavioral Health Network. Patricia, welcome.
Thank you.
So as the storm damage adds yet another layer of stress and complexity to people's lives during this time, what do you advise for those struggling mentally and emotionally?
Well, this is just another blow to individuals who either were struggling before the pandemic or have been struggling since with anxiety and depression. You know, not having power, not having access, for example, to media, being worried about your refrigerated food, not having anywhere to go. You know, we just heard that the state parks and beaches are closed. Those are all things that just sort of pile on to the stress that people are already experiencing.
What resources do you recommend for those looking for healthy coping mechanisms during this time?
Right. I think that, we've talked about this a lot. Today's probably not the best day to go out for a walk, although it's pretty calm out there, but we know there's still a lot of downed limbs and wires. But getting outside, going for a walk, biking if you can. If you're somebody who does yoga, trying to do some of that. If you're somebody that likes to cook, whatever worked prior to the pandemic that seemed to help you relax, those are good things to go back to now. And if you haven't tried any of those things, I think that it's really important to remember that physical exercise and physical activity is very important for people's mental health.
All right, for those who are having a hard time seeking help, what message would you like to send?
I think that it's critical that people do seek help, even if they're not sure that they need it. They can call and speak with somebody and see if, that individual thinks they need to come in right away or, just see somebody for a short period of time. We don't want people staying out there who are experiencing any symptoms because things may get worse, and there is help out there.
All right, tell us about the Hartford Healthcare Community Care Line. What can people expect when they call?
Sure. So the Care Line number is another way to access services or to speak with somebody who has a behavioral health background. The number is 860-972-8100. And when you call that number, people are available to speak with you, whether you need a few minutes to talk about something that you're experiencing that day, whether you're concerned that you might need to see somebody, or whether you feel like you really do need help right now. We can get people into treatment, we can just support them, but we want to make sure that people know there is help out there.
All right, we'll get that number on our website and our app. Patricia Rehmer, thank you very much for joining us. We appreciate it.